Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a board-certified endocrinologist who's also a functional medicine physician based out of Oklahoma City with a license to see people telehealth and virtually in 43 states, including California, Florida, and New York. Today, I have an amazing guest and a good friend, Dr. Meg Mill. She is a functional doctor of clinical pharmacy, and she kind of specializes in histamine and migraine. And so I wanted to bring her on because migraines are a pretty hot topic. And we talked about so many amazing things when it comes to migraines. Migraines are one of the most debilitating things for women, especially in hormonal years. So anytime that we're menstruating, and then as we become menopausal, because hormone shifting can cause migraines. And so it's chronically debilitating in some people, not only physically, emotionally, but just literally impacts their lives to where they can't go to work. And there are actually ways that you can treat this, you guys. And from a functional medicine perspective, this is what Dr. Meg does. And I love that. And she has programs and different things you can do. She's also kind of becoming a little expert in histamine as well, which is a hot topic. So I did ask her some things about that. But we basically just walked through, she told me there are 50 reasons you can have migraines. 50. And so some of it is a combination, but we talked about some of the top things, which are dehydration, sleep issues, food triggers, and we list a bunch of food triggers, one of which is wine. So I'm sorry, but wine is a trigger. And then we talked about hormones and how high estrogen compared to progesterone or estrogen dominance really affects migraines. What environmental triggers can actually cause migraines. We talked about how working with a functional medicine provider like herself or modern endocrine is different than traditional medicine, why we think traditional medicine has failed, especially in the realm of migraines. And then we also talked about some very simple, basic things that people who suffer from chronic migraines or headaches can do to help them feel relief. So I thought that this was a very interesting episode. It's something that you can definitely listen to and then implement to hopefully decrease the severity and intensity of migraines almost immediately. So again, I love this episode. And just a little bit about Dr. Meg Mill. She's a leading women's health expert, a doctor of clinical pharmacy, and a certified functional medicine practitioner with over 2 decades of clinical experience. She helps women around the world resolve chronic symptoms like fatigue, digestive issues, migraines, hormonal imbalances, and histamine-related conditions, especially when conventional medicine has failed them. She's the creator of the Radiant Method, a proprietary root cause framework that empowers women to rebalance their body, regulate their nervous system, and reclaim their energy, clarity, and confidence. She is a best-selling author and a host of a top-rated podcast, A Little Bit Healthier. I've actually been on that podcast. She's also a sought-after speaker and summit host. Her work has been featured on Fox News, CNN, ABC, NBC, CBS, and Forbes. So I hope that you all love this episode as much as I loved recording it. I think it's going to be very powerful and help a ton of people. Today, we're going to talk about migraines. So one of everyone's favorite things. So I have Dr. Meg Mills, and she is kind of an expert in this topic. And so I brought her on to talk to you guys. I know you guys have a lot of questions about headaches, and she talks a lot about migraines. And so we're going to just kind of talk a little bit about what causes migraines, what makes them worse, are they hormonal, is there certain food? So we're so excited to have you on our podcast. Thank you for joining us today.
Thank you so much for having me.
Yeah, so maybe start off by telling everyone sort of what you do every day. I think that's always helpful. You're a doctor, what do you do? What do you practice? What sort of patients do you see? And kind of what got you interested in what you're doing now before we kind of dive in and talk about one of the most common conditions that women suffer with, which is migraine.
Well, yes, thank you. So I have a virtual functional medicine practice. So I work with people all over the world, mostly women, and really working on putting our body back into balance. And I think that there's so many people, so many probably of your listeners that have been just let down by the conventional medical system. And I was one of those people. So that actually is what, I think a lot of us have these personal stories, which is what led me to this place. I was really having a whole host. I was really young at the time. So I was going into different doctors. We moved around a lot at the time. And here I am in the medical field, and I'm going to see specialists and I'm being told, oh, you're fine. You're the picture of health. Everything looks great. And I'm like, I can't eat. I'm having terrible anxiety. Like all of these things are going on. I can't figure it out. There is something wrong here. Like I'm not imagining this. So I started doing my own research. And this is back before really there was a lot out there. We're so lucky that so much has emerged in the last 20 years, but it's finding out like what's going on. So I started doing research and I found functional medicine, and I really started to dive in and really heal myself first, where I'm like, okay, these are things that are actually moving the needle. When I heal my gut, all of the steps, and really we can get into some of them, that I took personally. And then I was like, okay, I need to make a change. I need to, really go back and get certified in functional medicine. So I really made a shift and went back, and now I work with women, like I said, all over the world. And what I started to see is that in my, like, when people are coming, one of the most common complaints, like you were saying, is women suffering with headaches and migraines. And I noticed like two patterns. Either they were suffering with headaches or migraines and told, you're going to have to live with this. This is just the way it is. We're giving just like band-aid approaches to get rid of the pain. Or they were coming for that purpose, or they were coming for something completely different, and they were normalizing it. They had suffered so long and no one had heard them. And it was just like, oh, I'm coming in for this. And I'm like, yeah, but you are getting migraines 3 times a week, or like, every month before your period. And you're not even bringing that up. That's not even like top of your list. And you're like, and they were saying, well, that, that's, I just have the migraine gene, or I've been told, that I just have these, they run in my family. So we're normalizing it. And then people can make these huge transformations where they go away. They don't have to run their lives around their next headache. And it really is so impactful.
Yeah, and I can imagine, migraines are probably one of the top losses of revenue and productivity for women in the reproductive age, because so many of them are hormonal, right? And so I think that is an important topic that a lot of people probably do get, for a lack of a better word, gaslit by their providers, or just like, oh, or they try to blame it on you, right? Like, well, it's your lack of sleep, or it's too much caffeine, or whatever. And to your point, there are some specific things that can be done sometimes that will actually be very impactful and change people's lives. And I had really bad migraines too in my 20s and in medical school, and it can be pretty debilitating. Like when I get one every now and then, I'm like, oh, it's awful, right?
Yes. And you're living around the next migraine. They're really something that when you're making some health changes, sometimes things you don't feel as much. So it's like you're shifting slowly, but how many migraines you get, the pain, and you're living around like, when is the next migraine coming? So it's really nice, like the freedom women feel when they don't have to live their life around this too.
Yeah. And so I think, to answer the first question, which is why are you so particularly passionate about working with people suffering from migraines, it probably stems from the fact that you had them, right? And then as a provider, you're seeing how much impact it has on people's lives to fix it. But one of the other questions I wanted to ask that I think listeners will be very interested in is, you're a functional medicine provider just like me, which is why I like having people like you on my podcast, right? How do you treat people differently than if they go to their regular PCP? So if they come to see a functional medicine provider, especially you, and they're having chronic migraines, how do you approach it differently than traditional healthcare, which has obviously failed us and them for many years?
Yes. So really the main focus of traditional healthcare is putting a Band-Aid on. We're going to reduce the pain. So we're really, generally speaking, not doing all of that much to actually reduce migraines. It's like, okay, you get a migraine, you're going to be put on a triptan, or you're going to have a lot of abortive medications just to decrease the pain. But we need to flip it around, and we need to say, why are you getting the migraines? When I've mapped it out before, and there's like over 50 reasons that people can get migraines, and they're in combination. So sometimes, it can be certain things or one thing that's triggering, but most of the time there's a wide variety of things together that's putting you over a threshold of when you're having the pain. And so this is a silly analogy, but someone said this to me years ago, and I was like, oh, this actually sounds like appropriate when we're talking about this topic, is if you went to a mechanic and you took them in and you gave them the keys to your car, and you said, my car's making a noise, and they said, okay, and they walked away, and they came back and they handed you a pair of earphones, and they handed you your keys back and said, drive away in this car. And you'd be like, no way, I'm not getting in the car. It's not fixed. And that's essentially kind of what we're doing. We're saying we're not even going to address the imbalance, like what's wrong that's going on that's telling your body, okay, pain is here, that's actually giving you a signal. We're not necessarily going to look at the signal. We're just going to put something to cover it up.
I love that car analogy. I'm probably going to steal that for lots of things in my
Yes.
life. So, yeah, so functional medicine is just the practice of actually looking at you as a whole, looking under the hood, figuring out what's going on so that you can fix those things and hopefully just fix the root cause of the problem and not over medicate it, right? Or over blame yourself. So I love that. I think that that's very important that people understand that. And so you're the mechanic that's going to like open the hood, look at the oil, look at everything that could cause it to have those sounds, and then try to figure out what's causing the sound, right?
Yes,
As opposed to just
exactly. We
writing
need to, we need
the
to see what is
prescription.
going on. Yes.
And I think it's also interesting that traditional medicine, right? Like we're so fast to write prescriptions like that, like a triptan in this case, but then really not thinking, okay, well, how does that medication work? Like, what is the mechanism of action? And if that is making the headache better, what else could we do like that that maybe wouldn't have these side effects or that wouldn't cause somebody to need this medication, right? So it's just very interesting how medicine has evolved, and Western medicine is so much different than Eastern medicine too, right?
I know, exactly. And I mean, we can combine them. I think you're doing a great job of that and really bringing things together because it's not terrible. I know like even in Eastern medicine it's like, oh, that they're doing things wrong, and we're saying, okay, in a lot of ways they're doing great things. So we don't want to bash it, but at the same time like we're missing the boat on so many things and you can feel better. And I think that's just like people lose hope. It's like it just feels like I have to live with this. I'm never going to feel better. And that's what just makes me so sad. And so if there's one thing that you take away from our entire conversation, it's that you can have hope, that you can live, particularly if we're talking, let's say, about this topic or so many other topics. But if you have migraines or you're suffering with constant headaches or anything like that, you can feel better. I've worked with people who have had migraines every single day where they really couldn't even work because it was so bad, living lives that are they're not living around their migraine. We can't say you'll never have another headache, but you won't have to live like that. You don't have to base your life on the pain and is it coming. We generally will start to see the decrease in severity first. So just a pattern over the years of working with so many people, and this generally I see that they become less severe as we're working on bringing everything back to balance, and then we'll start to see them spread out more. So we see like severity go down generally and then incidence, but it's a little bit different for everyone.
Yeah, and that's so powerful because if you have one of these debilitating migraines that, keeps you from going to work, and at least you can change the severity to it's a painful headache, but maybe you can get something done productivity wise. I mean, that in itself is huge, right? And if you're having a migraine 3 times a week and now you're having it one, that's huge too. I mean, that's a 66% reduction in headaches. So, and I think, and hopefully people, I think you bring up a good point. Like, hopefully people hear us that, the downside of conventional treatment is that although you may, treat it when it's acutely happening, we're not chronically preventing it, right? And I think that's the main downside that people have to understand. And traditional healthcare, is sometimes needed, but band-aiding things long term when we're not acute, when we're not dying is not a good thing. Like, and I say this all the time, like I'm going to go to a hospital if I need surgery and see a surgeon or get my bone fixed but what I don't love about traditional healthcare is just this chronicity of diseases that we just continue to put band-aids on instead of addressing the cause and trying to actually, like you said, decrease the severity or decrease the frequency of the issue.
Yes, absolutely. And really we can, and I think what's amazing is that we can. And sometimes I think just knowing and feeling empowered and thinking there's something that can be done. It's not me, it's not my genetics, it's not a problem with me. It's something that there's just generally these imbalances that we have to put your body wants to heal. So how do we guide you to put things back in order where your body's in this place where it's not signaling the pain anymore?
Yeah, no, I love that. So you mentioned that there are 50 reasons you can have migraines if you look at all
Yeah.
the individual or like the combination. So
hmm
like I can think off the top of my head, food, stress, lack of sleep, hormones. Those are like the big ones I can think of. Are there any that I'm missing that are big ones that would surprise people that we could just list, or are
Yeah.
those the
We can
main ones.
start with, we can go through them, but we can start with, let's start with like simple so that it's, takeaways. What can you do?
Mhm.
So dehydration is,
Yep.
an independent risk factor. So are
Mhm.
you staying hydrated? And are you sipping, like these are like little things that we even have to look at. Like, are you sipping your water through the day? So a lot of people are drinking a lot of their water at meal times or in big gulps. It's like, oh wait, I didn't drink. I'm gonna, chug
Yep.
my water bottle here. And a lot of that's going through you because when you're drinking so fast, can your body process all that fluid at the same time? So taking sips throughout the day can be really helpful. Adding electrolytes can be helpful. So we want to think of cellular hydration. We actually want to make sure that that water is getting into the cells. And then another thing that is, an easy, free thing is sleep. I mean, so are you actually sleeping? And I think that's one of those things that we just need to like shine the mirror on ourselves in our own lives and say, like, do I prioritize sleep? That's something that, am I staying up an hour later because it's like that's the time I relax, or, what are you really prioritizing sleep? Because I think sometimes that like we don't. So we need to, that's a non-negotiable for me these days. It's like, nope, my sleep is really important no matter
Mhm.
what I'm doing. So those are like free and easy. So then we can move on to food. And so food is a little bit more complicated when we're talking because there's two different patterns that we see when we're looking at food. So we have foods that we know trigger migraines, like that are like historically more migraine triggers. So we're talking when we say this more about foods that have histamine. So like
Okay.
fermented foods, aged cheese, like sometimes like healthy foods that you think like tomatoes and strawberries and avocado or some high histamine foods. But then we're also thinking of tyramine containing foods, salicylates, which are citrus. So like the lemon water you're drinking to help with detox, like that could
Mhm.
actually be contributing to your migraine. So this is like a point. They're not always unhealthy foods, but they might not be serving you right now until you get things back in balance. So we also have nitrates, sulfites, MSG, aspartame, like artificial coloring and flavor. So all of those, we're looking at a bucket of like, okay, those are, but like if you might have heard of the migraine diet if you're someone who's like been searching. So a lot of those foods are in there. So bringing those foods down really will lower your threshold potentially. So the thing that is a little bit confusing here, and then we'll talk about the other bucket, but the thing that can be confusing here, I think, for a lot of people is that there's a lot of factors that go into the threshold that's going to actually give you the headache. So it's not consistent throughout the month necessary, or depending on your stress or your environment or your hormones. So I'm going to use wine for an example because it's a big one. So
Mhm.
people say, okay, well, I had a glass of wine and it caused me to have a migraine. And then I had another glass of wine and like a week later and I was fine. So it's not the wine. Well, it could be the wine in combination with aged cheese, in combination with you ovulating and your estrogen spiking, and another
Mhm.
day, or like another day you didn't sleep, and another day you were in maybe your follicular phase and everything was balanced and you didn't have other combinations. So I think that can be tricky for people because it's not always the same every time. So it's not like you can just see like every time I eat this food. Now some people can, but there is a little investigation here that we need to do.
So how do
So
we do that?
yeah, so one good question. So
I'm very intrigued. How,
yes,
for all you women out there who are like the wine, yes. Like,
yeah.
and the other thing I want you to ask too is, or I want you to answer as well with the wine is like, does it matter if you're cycling versus not? Does it matter if you're on consistent hormones? Like, will that change?
Well, it'll be more consistent. So I think when you're cycling, the thing is, and then we're erratic in perimenopause. So, when we have the cycle, we're having these change in hormones through the month that we know about. So one of the other things that are migraine triggers are estrogen dominance over progesterone, when we're seeing high levels of estrogen over progesterone, and when we're seeing rapid changes in estrogen. So, when we're looking there, estrogen causes our mast cells, which are part of our immune system, to release histamine. Histamine will be one of the triggers. Histamine can naturally cause inflammation because that's part of its job but it can be one of those triggers, like there's high histamine food. So if you're eating a histamine food and your estrogen's high, and maybe you're in perimenopause and your progesterone's dropped low, that's going to create like this perfect storm. So sometimes that's why like in perimenopause we will see more, we'll see like the headaches pick up, and then menopause sometimes not, some women still do get them, and like in menopause there's a lot of reasons, but we'll see them sort of stable, we see this hormone stable out. So it's not that you can't, but it's you're seeing less variation as one of the factors. Does that make sense?
Yeah, for sure. Because all these things are, it's kind of like when you look at somebody as a whole, right? Like when you try to blame, everyone's fatigue on or weight gain on their thyroid. And it's like, it's not just your thyroid, there's other things involved, right? And so, same thing here. You've got to look at your hydration status, you've got to look at your sleep, you've got to look at your foods, in addition to what's going on with your hormones. So, yes, that all makes sense to me. And I do think that's very interesting that when your estrogen is high, and you said something about estrogen dominance. So, the interesting thing about estrogen dominance, too, I think that people need to realize you can have estrogen dominance and not have high estrogen levels. So, this is really important for people to understand. When you're transitioning through menopause, perimenopause, etc., or even when you have issues with like PCOS and you're younger, if you have low progesterone levels, and also, by the way, low progesterone can be caused by stress, right? So if you have a lot of cortisol, a lot of stress, pregnenolone in our adrenal gland is converted to cortisol and progesterone. When you are highly stressed and your body thinks that you are under attack or something's wrong with you because of what you perceive as stress or lack of sleep or dehydration, a lot of that pregnenolone is shunted to cortisol, and you don't make progesterone. When we don't make progesterone, which a lot of it is made in our adrenal gland, not just in our uterus, but we're making estrogen from our ovaries, your body senses that you have estrogen dominance, even if your estrogen is quote normal or even low, if you have no progesterone. And so then people end up with these symptoms like you're talking about, like they can get even lower amounts of estrogen can get you to release mast cells and can end up with histamine issues. And I think there's a lot of people that don't catch that because doctors are like, oh, you're not estrogen dominant, your estrogen's not high. Well, it doesn't matter. What matters is the ratio, right?
Yes.
So I
And
think that's
yes.
really important.
And do you ever use Dutch testing?
A lot.
Okay, so another really common, like I was like, I need to do a study on this because I work with so many people with, migraines. But another
Hmm.
thing that I see often is the 16-OH metabolite. So the Dutch test will show, so most likely if you're going into the doctor, if you get blood at all, you're only going to get the estradiol levels in the blood. But when we look at a Dutch test, we're looking at just a real brief, like a recap of it. We're looking at phase one and phase two metabolites of the estrogen. So exactly what you're saying. So a lot of
Yeah.
times we'll see low estrogen, which would have not been caught because your estradiol's normal or low. But I see a lot of people shunting it over to the 16-OH metabolite in particular with migraines. It's just a very common thing, just working with so many people in this that, my migraine ladies tend, not everyone, but tend to shunt more down the 16-OH. So you have to use it and lose it when it comes to estrogen. And what we're seeing then is we're seeing low or normal estradiol and high 16-OH metabolites, which are creating the dynamic of the migraine. So, just things like shifting that way you metabolize your estrogen. We don't necessarily need to like do any like lowering in a lot of different ways, but we're just shifting and optimizing metabolism can really help too.
Yeah, no, that's very, very good point. And also, this is why a lot of times when you do hormone therapy, I tell people Dutch tests are great so we can see how your body is metabolizing your hormone. Because if I take a hormone and we give you the same hormone, Dr. Meg, we're going to metabolize it differently. And so then we also can look at, okay, what can we do to shun our metabolism away from the 16-OH pathway? Or we look at, are you having a gut issue and we're recycling estrogen, we're not getting rid of it? Or are we really constipated and we're just not pooping so we can't get rid of it? So there's so many things, again, that go into hormones. This is why hormones are not easy. And you have to go to somebody who understands all of this. But to your point, the 16-OH metabolites, yes, we see a lot of people who have high levels. And so then it's like, okay, you have to work backwards and figure out how do we get our body to actually get rid of these metabolites. Like you said, use it or lose it. I like that.
Yeah.
Yeah.
Well, it helps
That's
people
good.
understand because it's like we don't not want to have estrogen. Estrogen's good for us, but we want it to clear out. So when it's building and it's staying, it's like use it and then lose it. We don't want it to stay around.
Well, how would somebody know if maybe their hormones were contributing to their migraines? Like, are there symptoms? How would somebody know, like, hey, maybe I should get that Dutch test? Like, what would you tell somebody in that case?
Well, I think, when, especially when you're seeing them at certain points in your cycle. So if you're seeing them like, okay, always the week before I get my period, there are people with classic patterns, the week before I get my period, I always have a migraine, or every time I ovulate, I have a migraine, or, you're seeing this over time. Those are definitely like, to me, like high signals of hormones because we're saying, okay, we're seeing it in the pattern. Some even women, if you weren't really a migraine sufferer and then you hit the perimenopause time and now the migraines are coming or getting worse, that's another like time that it's like, okay, is that the change in your hormones? Or like you're saying, if you're under more stress and now they're starting to come, like what's going on downstream with your hormones and all of those things. So I think it's really looking at patterns. So you know what, we shifted, but one of the things that I have people do, because you were asking me and then we kind of jumped into hormones, but you were saying, well, what do we do about it? And one thing that everyone can do that's listening that you is easy is sometimes I'll have people print out a blank calendar. And then when you get your migraine, write down the last 24 hours. So write down what day of your cycle, write down what you've eaten, write down your stress level, if you sleep, like if were you dehydrated, what was your water intake, what was your environment, did you travel, like what are all the things? And you don't have to, because I think people don't want to journal and write down their food all the time, but you don't have to do that. You only have to do it when it's happening. So it's a little harder if it's chronic, but generally, if you're not chronic, then we can look at patterns. And I can't even tell you how many interesting patterns have come out from that little trick alone. Like, okay, every time, like I mentioned that lemon water, every time I'm drinking lemon water, every time I eat olives, some people, and it's really unique, but you'll start to see your own pattern and you'll start to see like what are the connections, and those are important, so don't ignore those connections, like things that show up over and over every day. It's between day 28 and 24 and 28 of your cycle, like those are important connections.
That's a good point. I like that. I think that journaling sometimes is really important. We do this for gut symptoms. We do this for a lot of things. And to your point, like you don't have to write down every single thing, but if you are trying to predict a pattern in anything, it's really helpful to know, your sleep and your hydration and your, mood, or just in general, the food that you're eating. Hormones are very important. So yes, you can see these patterns. And then, that's so helpful. And it might not be that exact day, but it could be something the day before too, because histamine is a little different, right? So like, and I want to talk to you about histamine, and maybe this is a good place to do it. But the other thing I wanted to ask you about is like surroundings. Are there anything in your surrounding that can contribute to migraines that isn't just you and your physiology?
Yeah, so I mean, I think when we're looking at it, we're looking at the overall load. So what is going on? So we definitely will see toxicities contribute to migraines. We can see mold contribute to migraines. We can see heavy metals. So definitely environment's important. So really taking a look at your environment. And that's even why I say, okay, like what's your surroundings at the time? You can look at little things like, do you feel better at your home or your office? Do you feel better if you if you travel? I've worked with people who have like, oh, you know what? When I travel, I feel great. And then I come back home and my symptoms start coming back. So there's these little clues that we're maybe not even thinking about. It's just like, oh, I'm on vacation. Well, is it, or is there something in your environment that's going on? So these are really important. But taking little steps like can you put an air filter, like an air purifier, in just maybe your bedroom? Can you look at what kind of water you're eating? Can you start to switch out your plastics and use glass containers, and just make some of these small changes over time? In those, a lot of people who have migraines also can have sensitivities even to like smell or detergents, or some of these things that you're not thinking about may be contributing.
I think those are really good pieces of advice. Yeah. I mean, and it's little things add up. And I did a whole podcast on that about like air, air quality. Like that's something we don't even think about. And air quality is super important. We think about our water and we think about what we put on our skin and our food, but like you breathe all day. Like that's the very
Yeah.
first sign of life, right? Like A,
Yeah.
B, C in an emergencies, airway is before heart.
Yeah.
So I think that's a good point. So your environment can contribute to migraines, as can everything else that we talked about. For people that are listening though, that are interested in histamine, because that's kind of a buzz thing right now,
Yes.
can you kind of describe to us, I guess, a little bit more about histamine? Like, what is it, why it's important, and what can cause people to have histamine? Or how can people know
Yeah.
they have histamine issues besides just migraines? Like, are there other things that it causes? And I know this is a
Yeah.
huge can of worms, but
There's a lot. I talk about
5
this
to
a lot
7
too.
minute condensed. I mean, just in
Yeah.
general, so people understand like what is
Yeah.
histamine and why does it matter?
So histamine is what we call a biogenic amine. So it's actually released primarily from our mast cells and our basophils, and it has an important job. So it increases the permeability of our blood vessels. It allows our immune cells to reach the affected area more quickly, and it actually causes inflammation in our body on purpose. So when we have an invader, we want to become, inflamed, like we're saying, to be able to get the parts of our immune system to that place that need to. But what happens is that many of us, we're seeing more and more people at this time get this imbalance in histamine. So we start to become what we call histamine intolerance. And this happens for two different reasons. And I like to use a bathtub. Like analogies just like help sometimes visualize it. But in this case, I like to use a bathtub analogy. So if you have a bathtub and you're filling it up with water and you have the drain open, then it's going to flow through. So you're really never going to get an overflow because you're filling it up, it's draining out, everything's fine. If one of two things happen, or both, if the drain gets clogged, or if you turn up the water, we're going to get an overflow. And that's what starts to happen with histamine. So let's talk about the drain first, and then we'll talk about reasons it gets turned up. But when we're talking about the drain, we have to break down histamine in our body. So it comes in, it also beyond like being exposed to something and having your body release histamine, it comes in through food and you need to break it down. So in our gut, we break it down by diamine oxidase, and you might have heard that as DAO. We have DAO enzymes in the gut. And then we also have histamine and methyltransferase. So we have to methylate it in our cells. So you're either breaking it down your gut or your cell, and you have to be able to do that. So once we start getting an imbalance in our gut bacteria, we can have even histamine producers, mast cell activating bacteria specifically. We can have damage to our brush border, all of these things where DAO gets broken down. So we start to not be able to break down histamine. And then you can also you can also get an issue where it's not broken in your cells. So that's the first part. So we need to be able to break it down. And then there's also things that are turning it up. So things like we're talking about dysbiosis, parasites, H. pylori, candida, viruses, tick-borne illnesses, toxins like mold. There's a whole long list of things that are causing this buildup where, we're turning the water up. And it's tricky because there's four different types of histamine receptors actually. So when we're looking at histamine intolerance, I think when you think about histamine, you're thinking often about allergies. So people think, oh, the runny nose, oh, my allergies are bad. But it can present for some people like anxiety alone, insomnia, gut health issues. So a lot of gut issues come back to, histamine. We're seeing even fatigue. I mean, there's hormonal imbalances. Migraines are histamine issues. Like we're seeing a lot of these different symptoms that when we unpack them, when we're putting pieces together, it's like, well, actually, you have a histamine issue. So we need to actually go back and fix the histamine issue. We have to fix the gut and really get the balance back so you can actually digest histamine and clear out anything that's activating your immune system. So all those things in the gut are that we talked about, they're then sending signals that we have an invader, we have an invader, we have an invader, and then your body is telling itself to release more histamine. So that's kind of the nutshell version of it, but it's saying, okay, what do we need to do? So sometimes, people can get really hooked into the low histamine diet. And I think and I can send you that. I have a really detailed handout on the low histamine diet that people can, because there's a lot of misinformation out there that people can go through. And it's a great way to see, am I having issues with these foods? They're often healthy foods, but often people say, when I brought them down, I felt a lot better. And we start to see that. The one thing I caution there is that it's a good tool to evaluate, but if you eliminate all these foods and you just rely on a low histamine diet, it becomes very restrictive. And sometimes we're seeing things down the road, you can become more reactive. So we really have to go back again, like we're saying, to the root cause of what's going on to get your body back into balance instead of just relying on this low histamine diet long term.
I think that's a good explanation, like a short
Yeah,
explanation
I know it's
of
a, a lot
histamine
in
and
there.
a lot of different symptoms. And there, I know there's a lot of buzzwords about it now too. So I have people who ask me questions about it, and I do think it's very, it's something that you can't just briefly discuss. Like it's something that if it's truly an issue, it's going to take some time to unravel and to figure out. But I do think that there are people out there for sure that have these issues, and it can
Mhm.
make things worse. Would you agree?
Yeah. We're seeing it so much more. I think especially after COVID, like it's like the virus and it's not that COVID itself, but it's again come back to even what we were saying about migraines, it's that load on your body. And sometimes people are like, felt fine. You can have even a virus where you're feeling like I didn't even feel that bad. And then 6 months later, everything starts, or you get bitten by a tick and then you don't even know it. And 6 months later, everything starts, or some sort of exposure, and then the immune system starts to become hyperactive. I think it's being seen a lot more.
Yeah, unfortunately, I have a lot of patients with that issue as well. So, but I will tell you that some of those people with those issues, once you balance their gut and you fix their hormones, and I mean,
Yeah.
it does get better. So
Yes,
that's
it does. Again, we need to remind that that's why we're here. It does get better.
yeah. So I want to kind of transition now to asking you three questions I always ask all my
Okay.
podcast guests. I don't want you to overthink them, just what comes to your mind right off the get go. And then after that, I'm going to let you kind of tell everyone where they can find you as well. So the first question I love to ask everyone is, what is one food that's most beneficial and why, if you just have to pick one?
Ooh, that's a good one. I think broccoli. I
Okay.
mean, broccoli has just so many nutrients, and the cruciferous vegetables are great for hormones. And like we were saying, really the pathways of hormones. So I would say if I had to just pick one food, I would say there's just so many, it just has such great nutrient value.
Yes. Although if you have SIBO and
Yeah,
some gut
yeah,
issues, you
that's
have to
true.
cook
Yeah.
it. But
Yeah, I
yes,
wasn't
I
going in
agree.
all those. Like, if you don't have food restriction, I mean, isn't that funny that we have, yes, we do manage all of those.
And
Yes.
it's still good for you if you have food
Mhm.
or gut issues. Typically, you just sometimes you have to cook it and kind of help your body.
Mhm.
But I agree, broccoli, people have said that. So broccoli is so great for your hormones. What is one thing that anyone listening to this podcast can do that will help them be healthy? That's 100% free.
Yeah, I would say, when, especially when even in this topic, sleep and drink water.
Mhm.
Stay hydrated. Don't skip your hydration. Think about it. Have your water bottle beside you and actually sleep and go to bed and really evaluate, honestly, are you prioritizing sleep?
Okay, I would agree. Sleep, hydration. And then what is one thing you wish you would have known about your health 20 years ago that you would have done differently so that you felt better today?
Yeah, I wish I wouldn't have taken antibiotics as a kid. I mean, I mean, that's more than 20, but I'm a little older than that. But, I wish it just as a child, I had a lot of ear infections. And I think then that's what, in those years I was saying that I had all of these issues and no one really knew about gut health back then, or I mean, was talking about it mainstream, like all the things, I rephrase that. No one was talking about the microbiome and all of the things that we're talking about and know about now, and I'm having all of these issues and I can't get answers. And I think a lot of it for me personally is that I had repeated ear infections as a child and they just gave me antibiotic after antibiotic after antibiotic. So now my whole life I'm chasing that where I have to, like, that's how my microbiome got started. And so now I have to always be chasing that, where I'm in a good place now and as you all can be, and it's not an issue, but I think that would have solved me years of pain.
For sure. I would agree with that, the antibiotics. So, okay, I think those were all really good answers. I want to say, as we kind of wrap up, first of all, like I commend you for, being in the functional medicine space, especially as a woman. Sometimes it's hard. And so we need providers like you to help people. So I'm so grateful that you do this and that help so many people that need help. But how can people find you if they want to? Like, how can they get a hold of you? how can they reach you, that sort of thing.
Yes. So my website is just Meg Mill, MEGMILL.com. And I have a lot of resources over there. There's even a work with me button. So I do free discovery calls and you actually get me. So I like to, before I work with you, I know I do my own discovery calls because I really want to make sure that we're a right fit, that this is, because we are diving into things and we really want to make sure that when we work together, that it's the right fit and that I can help you. So yes. And then I also have a podcast called A Little Bit Healthier, which you have also been on, and we have tips every day that you can do, that we're trying to bring things and ideas that are things you can do every day to be a little bit healthier. So join us over there. We'd love to have you listen to the podcast. And then I'm over on Instagram at Dr. Meg Mill. It's just DrMegMill.
Awesome. Well, thanks for coming on and educating us about migraines. I know I learned a ton of stuff, and I'm sure our listeners did too.
Thank you so much for having me, Cassie.
So now you all know why there are 50 possible causes of migraines, right? So I think that we dove really deep in this episode. I love that we have some simple steps we can do, but please, 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 like the journal that she was talking about, if you suffer from migraines or you know anyone who suffers from migraines, make sure that they listen to this episode and do simple things like even that journal exercise so we can figure out what those triggers are and help decrease the severity and the intensity of migraines, because it is a very common cause of lost productivity and life in people. Again, if you thought this was helpful, please share this episode. This is how we get the word out. So anyone that you know that suffers from migraines or has mentioned migraines, please send them this and say, listen to Dr. Cassie and Dr. Meg's episode. This is going to be life-changing. I appreciate any sort of reviews, whether you listen to us on Apple, on Spotify, or YouTube. Reviews help me know that you love what we're doing. Make sure that you're following me on social media. I'm at modernendocrine_ on Instagram. Make sure you go there and tell me what you want me to talk about. And keep in mind, Modern Endocrine is licensed in 43 states now, including California. We do virtual telehealth visits. You do not have to leave your house. All of our states are listed on our website. There is also a button to become a patient. You can even book right online. But I would love to help take care of you from a functional medicine standpoint. We do so much gut health. We just do great things to make people better, which is why I feel like I have one of the best jobs in the world. Thank you so much for joining me this week. Make sure that you tune in next week and have a wonderful week. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.